How do we align our money to our mission? And why wouldn't we be able to? And so it was these audacious questions, which push. Now I will say, there's all sorts of forces that would love to not have this happen. It's inconvenient. Banks don't like purchasing non-standard things. It's painful for them. We just recently found out that one of the resistance the banks have is that it's not electronic. So because it's still a paper-based transaction, they don't want to deal with it. So there's all sorts of challenges with it, but it was about thinking about what our end goal was. I could have raised the money a lot of different ways. I did not want to. It was critical that CSI be for the community, by the community, and that we not be beholden to anybody who didn't care about who we were. That was fundamental to what we were trying to do.
I just wanted to, hi, my name is Rob.
Hi, Rob.
Just wanted to address the barriers to doing something like all this amazing stuff you're talking about. The barriers to doing it in a rural setting. I'm in a small town called Dunville, out on Lake Erie, and 5,000 to 7,000 people, mostly farmers around a small town. There are no barriers. We have a center for social innovation, although we don't call it that. We have an awesomeness fund, although we don't call them that. It's an envelope in my desk. So I work for Salvation Army. I do emergency housing for all of the Norfolk counties, and I've learned that if there's not a column for can openers to give to people who are homeless, there's no can openers. So when I started the job over 3 years ago, you gave maybe a woman who was leaving an abusive situation, you gave her cans of food and no can opener. And I couldn't figure out how we can get around this, and one of my mentors said, why don't you start a fund? So if anybody wants to talk about how this kind of stuff works in a rural setting, we are doing it. We have a community center that we just had a soft opening this last week. We're doing amazing stuff, just like what you're talking about, but it's just people doing it who have no idea what they're doing. It's beautiful.
I just love that answer. That makes me so happy. And I think it's just that can do. Like, how do we make it happen? What is okay? We didn't really want it anywhere. Go ahead.
Yeah, just two simple questions. One, taking a leap from a $500,000 organization to a $4 million loan or something, that I want to understand a bit more, that what really empowered you to do that.
Yeah.
Secondly, bringing a city on board where they will give you a loan guarantee, because normally cities or governments are not that quick to respond. How you were able to convince the city of Toronto to come on board and then do the rest of the things, because certainly that has enabled your success onwards and expansion.
Yeah, and I thank you for the question, because I did buzz through that community bond stuff very quickly. So, there were 6 years prior to us buying the building that allowed us to build the networks and social capital that we needed in order to get to a place where we could get a loan guarantee. So we had a track record, and it's important to know that we had a business model. So I charge rent. I'm in the rental bit. I'm in property management. Right? We charge rent. And so we are a social enterprise that operates just barely in the money. So what had happened, and by us, our business model being about leveraging the power of small, one of my colleagues, Michelle LeVay, who's an incredible social entrepreneur who runs Options for Homes, another example of an amazing organization. He said to me, he says, Tanya, he always saw me flitting around doing all the who considers themselves the connector or the networker in their community? Okay, come on, I know there's more. So what's interesting is the question is, how do you monetize that? And that's what he said to me. He says, Tanya, if you could turn your social capital into financial capital, then I'll be impressed, right? And so that was the opportunity. That was one of the key triggers to that. But what had happened was, I had been building social capital with the city in advance. I had been building relationships and building partnerships. And what had happened is I developed a relationship with the economic development department. And what we knew and what we discovered through our collaboration with the city around economic development is that actually just our CSI Spadina location represents over $25 million of business every year. And that we are a microcosm, a little economy that happens in and of ourselves. And so what we're doing is we're actually producing and supporting small businesses like never before. Every one of them with a social mission. But this was important because what had happened is the story was quite simply, we had not asked for any money from the city forever. But what had happened is we started to figure out ways that we could collaborate with them. And so over the Christmas holidays, right before we made the decision, I went and I had a meeting. I called up the head of the economic development department at the city of Toronto. Who's from the city of Toronto here? Yeah, this was it. Economic development department's name is Mike Williams, or at least it was then, I'm pretty sure it's still now. And I said to Mike, I took him for coffee, and I said, Mike, what do you think about giving me a loan guarantee? And he said, do we do that? I said, yep, absolutely, Mike, you absolutely do that. And so we began the process, but I just want to say, it was about us having a track record. It was also about us buying an asset. It cannot be understated. The ability, I mean, what happens if I screw up is that the city takes control of an asset. And the building, well, just so you know, I mean, we spent $6.8 million to put that thing together. It was just reassessed at $9.4 million. That means we've now got a sweet little $3 million little pool that we can go buy our next building with. It was absolutely critical that we had an asset that was of value and that the perception was, we did massive risk aversion, like a massive risk mitigation by having that. They put the loan guarantee, so if we screw up, they take it. If they choose to, they can liquidate the assets. Everybody gets paid out. I did not take $1 of debt beyond that original appraised value of that building. So legally, it's quite a secure investment, and that was one of the keys. So it was both building advanced social capital and also having something which was really pretty safe relative to like a cafe or a new business that you don't know if you're going to get a customer or not. So I hope that helps answer the question.
I have just a couple of comments that I'd like to make from a rural community.
I'm so unable to, I'm so sorry.
They say that imitation is the finest form of flattery, and I would like to say thank you to you for inspiring us in Chatham, Kent. I was on the board of the Ontario Health and Communities Coalition for a number of years. We used to meet at the CSI in Toronto, and when we had the opportunity to move our United Way office from one location to another, we built the 425. Yay! 425 McNaughton Avenue West in Chatham. We now have a 10,000 square foot building that accommodates 7 other not-for-profits. So we are modeling what you have done in Toronto, and it is working really good. So thank you.
Any other questions, or shall we turn this over? All right, well, listen, just one more time, I'll just say, I appreciate the mutuality of inspirations, and I really am blown away by the work of this network, and thank you for all you've given me in the last 20 years. So thank you very much for your time.
On behalf of Health and Community Coalition and HC Bank and all of us in the room, thank you for your share today. And we want to give you a small token of our appreciation.
Wow, I tweeted like a mad person during that. That's awesome. So panelists, come on up. So we have a pretty exciting, well, mine is slightly biased. I think it's a very exciting panel. No pressure. What we wanted to do with this time on the agenda is give some folks who are actually doing this on the ground an opportunity to digest and share some of their experiences. So we have 3 fabulous folks. that are going to share some experiences with us. We have Bob Gardner, who's the Director of Health at Wellbeing Institute. He's going to be our moderator today. And in addition to his professional role, Bob is learning to play soccer with his left foot. And if we're very lucky, we'll get a demonstration. We also have Norton, who's the CEO of Human Endeavor, and Norton's an engineer turned community mobilizer. And last but certainly not least, we have my boss, Barb Willett, who is an avid fan of Downton Abbey, and we may spend a fair bit of time talking about that one of the. So we're just going to give them a second to don their helmets, and then Bob is going to get us started. Thank you so much, and I'm happy to hear you.
Salut Michel. Salut, ça va? Oui, toi? Oui, pas de plainte, sauf des problèmes techniques. Ouais, non, c'est correct, ça fait comme une heure que je suis. Je viens de réaliser juste ça, je m'appelle non. Non, de comme, je suis la mauvaise personne, je suis comme, j'ai pas du tout. Là, tu vois, ça va être problème technique. Ouais, mais c'est comme les diapos, je vais tout tester. Non, et marché. Finalement, dans les diapos, ça marche pas. Ah, la technologie, c'est toujours comme ça. You just gotta roll the punches. Exactement. Oui, c'est ton travail. Oui, félicitations pour le lancement des
I wasted my opportunity to get coffee.
I'll get you coffee. Want to get coffee?
Nice.
If I don't come back.
And I'm going to pass it over to our alternate.
Comment c'est connecté?
Alright, so thanks everybody. Thanks for all of this. What we're going to do here is try and take off a bit from some of the big ideas that Tanya's been putting before us, and the experience of all of us in trying to drive change in all kinds of different situations, and the experience of all of you in driving changes wherever you are. I suspect out here we might have a little bit of a little bit of a mostly urban experience as well. So I think it was really interesting the way that earlier session, lots of folks from the smaller cities and the rural areas were able to build on their experience and make those connections. So we'll hopefully be able to do that today as well. But in talking about this beforehand, one of the things that we were all thinking about, this seems to work all right when I'm going one way but not the other. How's that? So I'm just kind of hold it. One of the things that we were talking about earlier on before is that these issues that we're all facing, deep-seated poverty or basic health inequities or social determinants of health, I mean, that's a good easy one to start with. They can seem just enormous challenges, right? And now we're all talking a lot more these days about systems and complexity, and it really does bring up the question of, well, how do we make our way through all of that complexity and where do we start? So the scale of change just seems, the scale of change just seems so overwhelming at times. Where do we get started, and how do we make connections between all these different issues that we want to drive? So we're gonna start with that, And Bart's going to say a few words, and George's going to say a few words. Then we're going to kind of weave back and forth a few of the issues that we talked about earlier on, and we'll just see where that takes us. Now, I think the idea was that we'll gab for a while, and then you'll get to gab for a while. But I don't think any of us particularly want to kind of gab nonstop. So if in anything we say, that springs a thought from anybody out there, just interrupt us and you know, at some point we'll stop all of us. And you'll have lunch, so there's the incentive. So, you know, don't worry about us talking for a while and then you talking for a while. Just jump in whenever you like. Thanks. So, Bart, make sense of complexity.
Yeah, really good. So in terms of, you know, taking that first step, I guess when I think about social innovation, and I think about, you know, the daunting issues and problems that are before us, it's really easy to feel a little immobilized. You know, oh my goodness, what can I do? So I started thinking about how do we move forward, and I went back to some of the literature, and there were a couple of key things that resonated for me. And I think they're fundamental for us, whether we're in a rural situation or an urban situation. But one of the things I want to start with is a bit of a sailor analogy. Because it really, I think, hit home in terms of what it feels like for us most days. And the sailor analogy I pulled, I brought a copy of it, which I would really recommend folks to go out and buy it. And no, I'm not getting a plug from the publisher. But it's getting to Navy. Because really I think it's fundamental piece of what we need to think about. There are no guarantees in moving forward and really making a difference. And if we could just get to Navy. And in the book, where the authors use sort of a bit of a sailor analogy when they talk about change. And if you think about a sailor in a storm, the storm is unpredictable, the storm is uncontrollable. The sailor's job is really to look for those patterns, to look for those trends, and to navigate through that, but not necessarily to change the course of the storm, because you can't. So when we're thinking about complex systems, we want to have an impact. We want to look for those trends, see the opportunities, and recognize that really there's a huge element in there that's beyond our control. So how do we do that? I think we need to work with, one of the starting places, there's many things to start with, but one for me is really thinking about building capacity in areas that are not necessarily well integrated on a routine basis into curriculum, into professional development opportunities. We really focus sometimes on issues and really sort of looking at concrete interventions, but we don't necessarily take the time to think about building our skills in a couple of areas. Meg Wheatley, who we know complexity theory and systems thinking, she's one of the gurus. And she talks about skills sort of in three areas that we need to think about. She talks about cultural and social skills, and those really are those pattern recognition, like the sailor navigating the storm, sense making, connecting in knowledge management, really taking the time to think, observe, and ponder. Our society is really action focused, particularly when we get out into the job. And there is a pressure to produce, a pressure to fulfill deliverables. There's seldom an opportunity to really encourage contemplation, reflection, and the sense of pausing and being still. I really like that phrase. So we can see patterns, and we can see the world around us, and we can understand those dynamics better, and really think about the change that we're trying to influence. This doesn't come easily. At Health Nexus, we're working within a strategic plan, and within that, we wanted to try and incorporate an element of reflection and really encourage thinking time. Well, I'll tell you, it's one of the first things to go when we get busy. We have not done it well at all. Yet, I'm reminded that it's fundamentally critical that we just give ourselves an opportunity to think and really practice thinking. The authors in Getting to Maybe talk about practice thinking, and that's kind of a bit of a novel concept. We don't do it anywhere near enough. The other area that I think, certainly within this room, we probably have a well-grounding, but around relationship building.
Tanya talked about it, and I think we know from our experience that relationships are fundamentally key. I liked Tanya's talking about really wanting to impact and strengthen civil society. That means we need to engage across sectors, between sectors, and we really need to also look at engaging those vulnerable populations as contributors and participants, not just recipients. And so I think there's some fundamental shifting and thinking about our relationships and the depth of those relationships and understanding how to nurture and support those. And that recognition that everyone plays a part. And then the other piece I think we need to enhance our skills around, just is around resource mobilization, really thinking about the financial, cultural, and political capital that we need in order to move those pieces forward. But you'll notice there's one piece that I didn't talk about at all, and for me this is important because when I hear the word, or at least when I used to hear the word innovation, I automatically thought of creativity. We don't talk about creative skills. We don't necessarily need to have a creative bone in our body. We need that to be assured. I am definitely not very creative. But what we do need to learn is we need to learn to be comfortable with complexity. We can't control or plan some of these initiatives in the way we do our standard interventions. Our world is not linear. It's complex and filled with the unexpected. And things don't unfold in the way that we plan. And I don't think really that, in most cases, at least certainly not when I was in school, we really talked about that. We really talked about the complexity of the relationships and the dynamics of the systems within which we work. I also think in terms of getting started, we need to think about some of those stumbling blocks that we're likely to encounter. There are no perfect solutions, for example. Our sectors promote, and value, best practice strategies. Those are important, absolutely important. But when we're thinking about social innovation, those can stifle. We need to think about a different approach. And the Call Foundation talks about the language of connected practice. And I really liked that. And they talk about that in terms of being based on observation and adaptation. That we need to trust our instinct and learn through our action. When we look at some of the examples in the literature about individuals and organizations that made a difference, they don't necessarily have it all thought out. They just have an idea and they go with it. And so we don't necessarily need to worry about is this program best practice. We just need to learn and to put our ideas into action. And then in addition to that, I would suggest that we also need to think about a different approach to evaluation. Traditional outcome-based approaches aren't necessarily going to be what will serve the best when we're looking at trying to institute and move forward some of these social change initiatives. We need to have an evaluation model that I think integrates critical thinking in a way that some of our traditional models don't. The other stumbling block for me that I think as we get started, we just need to keep in the back of our mind is that there are no guarantees that we'll be successful. And we can learn as much from our efforts that perhaps bend and curve as we go through what it is that we're trying to achieve than those that actually go from point A to point B. The authors in Getting to Maybe, they talk about that we can only act from where we are. And that even in the smallest ways, when we act and connect, we engage in the world's complexity and we shift patterns. So we're making a difference. But there's no magic recipe or process to follow. And there's a huge element of uncertainty. And then I think we need to look at, and this is a part where, based on the work that we do on a day-to-day basis, I think we're well rounded here. But it's taking the time to articulate our vision and our desires and our ideas, and then finding and nurturing the relationships with those who have similar passions and similar interests. And then I think we also need to be prepared to be disappointed, to be discouraged at times, but also to learn along the way. And I think I just want to close my thoughts on getting started with how the authors are getting to maybe wrap up their book. They talk about there are no perfect people and there are no perfect projects. We're not measured against perfection, only called to do what we can, to set out on an exploration to imagine destination and imagine good. So forget about the fear, forget about the guilt, forget about the fact that the doorway makes no promises, just step through. So you just need to get started.
Okay. Now, speaking of creativity, I'm going to take a bit of poetic license here and a neat segue to York. Getting to make big insights are incredibly valuable, of course. But when you're all sitting there filling out your quarterly reports to your local health integration network or your 12 different funders for your various programs, most of our government friends and our other funders, they're not too keen on maybe. They're not too keen on, well, don't be afraid of a little uncertainty. They do want to guarantee. So I've been thinking about how do we get around those traditional mindsets of funders, of professionals and providers, and how do we, and then maybe this ties nicely back to Tommy, isn't it, about how do we rethink the way we do things?
I think earlier introduction was that my background is in computer engineering, and I think I established a small organization called Human Endeavor in 2004 when I left my engineering and wanted to do something different. And I think some of the strength of the values that I will share with you, that is really the message what was that is within you if you want to bring that change. And certainly we have demonstrated it through our organization. So one thing that personally from my, and I will mainly talk about our experiences through Human Endeavor and how we have implemented programs in healthcare, which are the primary preventive healthcare, how we have set up social enterprising incubator that we are replicating now in many other cities at this point. And all those examples will give you a person who has no clue about social services or preventive health services. If he or she, like in my case in particular, that if I can build my capacity to do something that I have never done in my life, then pretty much anybody who is really determined to do something, they can take it and really do those things in their community. So one thing that we have always looked at it, being an engineer, it's a very different mindset when you are an engineer and in a commercial field or business field versus being in the health services or government funded organizations. The mentality of working where on one side you think about cost cutting and better services every year versus government funded projects where it's if you need more services, you give us more money. If you need better quality, you give us more money. The dynamics and the thinking is totally different in both sectors. So I think one thing that we have done is think differently, which means you don't just, if you're a health service provider, you don't have to stay within that framework. And certainly I can quote one or two examples regarding think differently, that how they have worked for many organizations who are creative or innovative and who are really thinking of making a difference. Then also one thing that is through engineering I've learned is that the complex let's say problems don't necessarily have to have a complex solution. They could be very simple solutions. It's just a matter of your out-of-the-box thinking that can take you to that step. And that's normally that happens. Like when we were engineering, anytime there was a complex problem in the organization, they would bring somebody from outside to actually facilitate that discussion. And we're always wondering that we are from the same organization. We know what the problem is. So why a person is coming from outside to actually give you leads or facilitating the discussion? The thing is that the person has no clue. He or she gets an idea about the problem 2-3 days, and they are looking at totally different perspective. Whereas if you are in that problem area, you have a framework and you're just gonna stay within that, and all your solutions are from basically within the same thinking. So you have to have some outside the box thinking. So maybe it's a point, I will just give you one example. If I'm not mistaken, the hospital name is the Great Ormond Hospital in the UK. It's a children's hospital. So they wanted to improve their process of heart surgery to intensive care, the patient from the heart surgery to the ICU. So they were trying to improve that process. So who do you think that they approached to helping that redesign their process? The chief, so most of the people will think that they went to some other hospital or doctors or they put a panel together. No, they actually saw similarities of this racetrack where cars come, they take all the tires out, oil change everything and put back to the racing track. So they invited Formula One racing, the Ferrari team, and said, this is our current process, we see similarities. And the chief scientist who was at the hospital, he was thinking different. So his thinking was, let's bring them in. So the team came in, they looked at the process of the hospital, they looked at how they were sort of revitalizing their cars on the racetrack, and they implemented a new process for the hospital. And after the process was implemented and 27 operations were done, the hospital and the research team was evaluating the process, they actually saw that the critical errors that their teams were doing before, they were cut into half after this process implementation. So no doctors involved, I mean doctors were involved, but the lead was from a Formula One racing team. They look at how things in the process and handshake should take place. So I think the thing that once you start thinking differently, you will find enormous opportunities to improve your process. And I think that's one of the things which really I personally believe is needed in healthcare or a lot of the social service sector, what we call disruptive innovation. Just improving incrementally the way current system is. Really our system in health, most of the individuals are healthcare here. So either it's a healthcare or government run, government or funded project. We are really at a point where these systems are not sustainable. You take healthcare or you take any other government funded project or foundations in project. So you need to start thinking in a very different dynamic that how we bring in some of those needed innovations so that we don't talk about 5% improvement the way hospitals are given. I was looking at some of the Ministry of Health targets for hospitals, 3% improvement here, 2% improvement here. I mean, these things ultimately are not going to result in a system change what is needed to if you need to sustain healthcare system or other services. So I think that the complex solutions looking more from a different perspective and too simple, then outside the box thinking, disruptive innovation. And then I think what Tanya has said about using community as your social capital, that is critical. Because unless the community is part of the solution, and they are, certainly we deal a lot with immigrants and marginalized communities through our economic development project. So we see them as our partners. So they are not our service recipients, that's not a model in our case at all. So we say that how these individuals, and even if you look at purely from business point of view, when we look at from our social enterprise point of view, so if I take an immigrant individual or couple of individuals, what we see is that they have skills. We know they have desire to succeed. What they're missing is an opportunity. Okay, if we can create an opportunity for them, this is what CSI has done, or this is what the social enterprising sector is doing. Then you have all the ingredients except just the missing opportunity. If you can give that opportunity to them through either your own social enterprise where they start working or somehow link them in a place, you actually will get a benefit that can come back to your organization if you run a social enterprise, or it's going to go to the society because you have enabled somebody to be successful. So these were some of the points, and I think what I see as well, we really need to understand what the barriers are. Because until you really understand what the barriers are, I don't want to go into the definition of social innovation because that's a philosophical discussion, and from purely from engineering point of view, do you have practical solution for that or not? And really that's what we need rather than writing reports and all those things, which I normally see a lot in the healthcare sector. Sometimes I wonder when we receive, I see a report where 167 recommendations are made for a certain sector, and I say, no, I don't just pick 3, they say, next year we're going to fix them, and then we'll worry about the rest, right? So I think that the whole thing should be very focused on practical implementation from our point of view, where every year you do something, you fix something, and that's how you go beyond. Social enterprising, human endeavor, the organization that I'm representing, it is very entrepreneurial. Whatever we do, regardless it's a healthcare or services in health or economic development. And I think social enterprising brings that people component that Tanya talked about. That social enterprise, so you have basically two sectors. One is pure market-driven economy, and the other side you have social services sector, which is totally, I will say, to a great extent, totally dependent on funding models, right? And the entrepreneurs are more, okay, we have to do something, they have no money, they have somehow they will raise funds and start making a product and then somehow get revenue out of that product, and that's how most of the large companies, you take Walmart or you take technology industries, that's how they have developed. So if you take that kind of approach, if you just think what social innovation is really for the public good, if you combine these two things together, that bring in some entrepreneurial activities or thinking into your solutions, then you get an advantage because you can now do a lot of things at your own, you can initiate a lot of things, and then really work for more their sustainability and their greater impact. So I personally believe that entrepreneurial activities, not to the extent that you make money, but if you mix them with the social services, and that's how really the social innovation for public good comes into picture, that you take a middle approach where you combine the best of both sectors, and that will create a lot of opportunities. There's a lack of understanding what social innovation is from my point of view. Don't go into definition, just stay with what's good for the public and how you can really do things that are not dependent on another. That's why I asked the question about when Tanya talked about raising this $4 million, because that's something I cannot understand, that I'm dependent to raise. And most of the organization, the biggest challenge in nonprofit is how to raise funds. And she seems to be pretty flexible that if it was not this way, I could have raised money the other way. So I was curious because that's where we are facing some challenges, that how we grow from where we are, and certainly the finances is one of them. So I think you have to kind of just look at how things are, they will work. Like, people have talked about some of their other solutions, how they are replicating CSI sort of things in their own communities. So we have done where some of our social enterprise, we are replicating and we are enabling other organizations building their capacity to do things in their own. So we are not raising money, 5 million to set a big CSI type of center, but we are letting your organizations to take our model, and we have a franchising sort of agreement through which we get some of the money back. That's how the whole bigger system will work, and people can support each other. Again, risk taking is another thing that governments normally don't encourage at all. And this is, we did a survey recently where the definition of risk taking was kind of misunderstood in the non-profit sector, that what it is. Some people said, we are in healthcare, how can we take risk? We have to do very certain things. So I think the risk taking could be different meaning in different sectors, but then you have to do some practice or the experimentation in the sector if you have an idea. And that once you do an experimentation on an unproven idea, there is an inherent risk in it that you have to take. But certainly you can gauge within your organization that how that will work, if a failure happens, who is responsible and all that. Because that is definitely an issue where the lack of innovation or people don't embark into innovation because it's uncertain and it's not supported by some kind of funder. Definitely, it's a very limited funding for innovation that exists. So I think these are some of the things that I personally feel that you have to address and understand the barriers and how to remove them. And thinking differently will enable you to get into really implement what Tanya said about smart solutions, where people are a part of your solution. It's not just you're building the capacity of program for your own organization, but you're building in partnership with the communities or other organizations.
Okay, great, thank you. We were going to have one more person on the panel, and they said I have to say something clever myself. Yeah, grasping at straws as you first. I'm going to make one recommendation, one nicely disruptive recommendation, and tell one story. The disruptive recommendation may be that one of Tanya's themes and one of yours themes was there's a lot of good ideas in a room like this and in all the sectors we work in. So how about if, say, all the community health centers in Toronto, and there are a lot, or in an area, all the public health units, all the nonprofit worlds, gave everybody who works there a day a week, or a day a month. Day a month in which they went to some other sister organization in a totally disruptive way. And they played that role of the friendly outsider who sees the problem through a slightly different lens. So the idea of bringing in the racing car team to help rethink healthcare. And in healthcare, the very best of healthcare innovation has been doing a lot of that. And of course, the other thing that the best of healthcare innovation does, and unfortunately there hasn't done much of it, is you see things through the patient or the consumer's eyes, right? You build in, well, what does it look like if you're in a hospital? Or if you're ill and you don't know where to go to? Or if you don't speak English terribly comfortably, and you don't know what those signs mean, let alone know how to go from specialist A to specialist B to that institution and that provider. So maybe if we just share and we have all kinds of forums and all kinds of listservs to share ideas, but what if we took that role of going around and disrupting each other's activities? It shouldn't be a way of making friends and influencing people to draw on that cliche. But here's my story, back to Barb's point about evaluation, and Noor as an engineer, as a profession. There's an outfit called Engineers Without Borders, and they do not unlike what doctors and others without borders do. But what they do that I think is tremendously innovative and courageous is they publish a report every year about their big failures. So they don't evaluate, just do these kind of glossy brochures about, didn't we do wonderfully? And look at how we're serving the people all over the world. It's, where we messed up and what we're going to learn from it. So a place like this is a pretty good, safe forum to talk to our colleagues from other places and just say, oh, geez, that went really well. And that went really badly. And we're not going to do that again. And somebody else says, well, yeah, we worried about that, but here's what we did. And it ended up working. Not so comfortable when you're going in for your annual report with your boss or with your funder. There actually isn't a box in most ministry or other funding quarterly reports on glorious failures, or even on lessons learned, which is kind of sad. So for our funders here, think of how they could change their accountability requirements and change their forums to encourage that kind of risk-taking so that we can learn from those glorious failures. One of the themes in all the way through today has been community animation, and building innovation from the ground up, and working with all kinds of diverse communities, including the most marginal. So how, and one of the ideas that I think has got a lot of potential is getting people together to imagine alternative futures. Alternative cities or alternative health futures. What would a really healthy society look like? And the opening remarks from our ministry friends were about, all right, so we really thought, what kind of community would leave the kids growing up healthy? That opens up an awful lot of questions, an awful lot of different ways of thinking of partnerships and thinking of innovative solutions. So let's ask both of our panelists here, and maybe some of you, what are some really good ways that we can work in all kinds of diverse coalitions and configurations to imagine what those healthier, more equitable communities might look like, whether it's a neighborhood, a small town, or a big city, whether it's a country as a whole. How do we form ourselves up in ways and make sure all voices get heard that can help us imagine that healthy, attractive, animating future? So another simple question for Barbara.
Yeah, well, you left me a little bit breathless in terms of trying to figure out how to scope that one. I think it does come back to a lot of what we've talked about before, and that's partly the relationships And looking for those venues where we can bring people together in a fashion that allows us to break down those silos and answer those questions. I love your suggestion, Bob, that we start at the end rather than at the beginning and carve it out together. I think those of us in the room have probably a lot of experience helping sort of facilitate and animate those kind of conversations in our communities. And I think we need to do more of those. So maybe we could just, I don't know whether or not this is a good opportunity for some audience participation. But it'd be interesting to hear about some of those stories where that has worked really well, where you bring those people to, a range of organizations together, including, as Tony talked about, look at those partners that you wouldn't normally think about that are interested in that end vision and help them shape together.
I would just,
Ideas from all of you.
on the collaboration side, I just want to give my point of view in the context of what Tanya and we have talked about. Being a small organization, we did a number of partnerships at the beginning to deliver services to the community, because that's what we believe was much necessary to utilize those resources which were not able to be utilized by immigrant communities or other marginalized communities which are not open, so we just became a bridge. What we are finding now is there's a limited dollar, and this is if I do comparison to be open as an entrepreneur or as a business individual, my thinking versus non-profit sector funding sort of model, then you have a limited funding, and we know that's not true. So everybody is sharing the same pot of money, and once you do partnership, in a way you are sharing the same dollar amount, is more split. So that's why people are always afraid of too many partnerships, because it's the same dollar not growing the way. Versus if you start thinking more entrepreneurial from business point of view, the more collaboration you have, the bigger market you're going to capture, and that means there's more opportunity for you. So I think what Tanya earlier talked about, that how those people who came together, either they were financially benefiting or their resources were getting, or their, let's say they have this new person who are more focusing on running the organization rather than just the administrative thing. So we are getting now to partnerships where we right away see that we actually present that by collaborating, what you will benefit. So if, just give you a quick example of our social entrepreneurial model that we have. So we have done our own incubator where we have social enterprises. So now what we have done is we have made a franchising model of it. So if your organization is interested, you can come to us. You see actually that, okay, if you adopt this model, this is the financial benefit and this is the social benefit you get in your community, and we build your capacity to run it, not as human endeavor we want to go and do something there. So organization is pretty autonomous, semi sort of autonomous in terms of doing things, because certainly there are certain limitations, but you are responsible for your area, financial benefits, everything. But it's like any other franchising model, but it's called social enterprising because you have those social benefits in the community that's mandated. But organizations, when they come, they are not splitting something, they are actually gaining out of it from the day they implement, and they are benefiting, but Tanya said, from CSI name, the same way our project name is EPIC. So they have a track record of 4 or 5 years that they take with them, and they know that what things work for us, they take those, and that we help them do that. So I think the collaborative model has to evolve then from the traditional model, where the organization benefit should be very clear upfront.
Okay, then I'm
I just wanted to answer your question. This is a really small scale level partnership, and there's no money involved, and there's no chance of ever being financed in any way, but.
Why not? Why not?
Well, maybe one day, I guess, but the nature of the work that I do, I'm a little bit of a feminist. I say that very lightly because I'm a women HIV community development coordinator, so a lot of my work is working in community environment, building partnerships, just that. So getting to know people, building the trust with various community, primarily social services. I've been working the last 4 years at bringing my community together and building a committee for International Women's Day. Last year, we managed to bring together 15 organizations, including various women-specific services, but also like the malls, and the Rainbow Cinemas, which is a theater